presentation. So those of you who don't know me, I'm Christine Bright, and I'm chair of the Pasco unit of the League of Women Voters of Hillsborough County. And on behalf of the League, welcome to everyone who's attending our Zoom meeting today. For those of you who are guests and aren't as familiar with the League is a nonpartisan political organization that encourages the informed participation of citizens in government and also works to increase understanding of public policy issues. Today we are hosting a presentation on keeping our children healthy during the COVID-19 outbreak. Our speaker is Jennifer Gray. Ms. Gray is the Executive Community Health Nursing Director with the Pasco County, Florida Health Department. She is a Florida native and recently moved from Pinellas to Pasco County. She has a BA in history and worked for the University of South Florida College of Marine Science as a laboratory technician in water quality, microbiology, and oceanography. Jennifer earned her RN and worked labor, delivery, and postpartum before accepting a position at the Florida Department of Health in Pinellas in 2008. She worked as a senior community health nurse, nursing supervisor, nursing consultant, and assistant director of nursing in Pinellas before accepting a position as director of nursing in Pasco. Currently, Jennifer is enrolled in the Masters in Florida Studies program at USF, which informs her understanding of the people, places, environment, and history of our diverse state. The Masters in Florida Studies program has also deepened Jennifer's passion for mission and vision of the Florida Department of Health and has sharpened her awareness of the unique challenges and advantages of Florida living. Welcome, Jennifer, and thank you for accepting our invitation today. The floor is yours.
All right, thank you so very much for having me here today, and I'm honored to have the opportunity to speak with you about COVID and how to safeguard our children. Let me go ahead and share my screen. And I'm going to start today with a very wide perspective, and then I'm going to move into some specific precautions you can take with your loved ones to keep them safe as we head into this unusual school year. So, SARS-CoV-2 is the first virus to cause a pandemic in many years. However, disease outbreaks, epidemics, and pandemics have been part of the human condition since the dawn of our history. We can all remember the H1N1 flu pandemic from 2009, and some of us remember being quarantined as children from mumps or polio outbreaks in the 1940s and 50s. However, for many of us, we have had the fortune to live most of our lives in a society where modern medicine and technology have decreased the need to control disease outbreaks through what now seem rather old-fashioned interventions. For bacterial infections like Yersinia pestis, that caused the Black Death and killed up to 60% of Europe's population in the 14th century, we have antibiotics now. For viral infections, we have vaccines. For instance, polio cases around the globe have greatly reduced since the introduction of the polio vaccine in the 1950s. Cases continue to drop, and the number of infections has gone from 350,000 wild cases in 1988 to 175 wild cases in 2018. We have a vaccine that eradicated smallpox, a disease that killed an estimated 300 million people in the 20th century. However, our world is ever evolving and new threats appear every day. Those threats include emerging infectious diseases. The University of Rochester defines emerging infectious diseases as any of the following: outbreaks of new diseases that were unknown before, known diseases that are now spreading quickly in numbers of cases or in numbers of areas where people are sick, and known infectious diseases that are persistent and can't be controlled. SARS-CoV-2, pictured in this slide, is a virus previously unknown to cause infections in humans and is the cause of COVID-19 disease. This is an emerging infectious disease that is novel to humans, meaning our immune systems have no prior experience with this particular virus. Although there are several other viruses in this family that cause the common cold and deadlier diseases such as SARS and MERS. A lot of people ask why COVID-19 is different from the flu, and they compare the number of flu cases each year to the number of coronavirus cases so far. Certainly, we've had a pretty active flu season in 2019-2020, resulting in an estimated 39 to 56 million flu cases in the US, and as many as 62,000 flu deaths. However, there are some major differences between the flu and COVID-19. Most people have been exposed to the flu, meaning their immune systems are better prepared to fight influenza infection. In fact, fewer elderly people died of flu during the H1N1 outbreak of 2009 because they had already been exposed to the H1N1 flu virus that circulated after the 1918 flu pandemic. We also have a vaccine that provides partial or complete immunity to circulating flu strains each year. We're also finding that COVID-19 is not only a respiratory virus, but a virus that attacks multiple systems in the body. Many COVID patients will have issues with blood clots and inflammation of the liver, kidneys, and intestines, as well as the lungs. Ultimately, we have few medications to manage symptoms, and we have no vaccine to reduce the number of cases of COVID-19. Those that contract COVID-19 are more likely to have severe illness and mortality due to infection than those that get the flu. While as many as 56 million flu cases occurred this past flu season, the US has experienced only 5.2 million confirmed cases of COVID-19, with over 169,000 deaths as of August 14th, meaning there are almost 3 times as many deaths from COVID-19, while flu infection rates are about 10 times higher. Florida had over 557,000 cases as of August 14th and accounted for about 9% of US cases of COVID-19, while Florida only makes up about 6.5% of the US population. Most of our cases are in Southeast Florida, but the Tampa Bay area and Orlando metro area have higher numbers of confirmed cases than other areas of Florida. There are some barriers to getting a clear picture of how fast community transmission is happening. So one measure we use in public health to standardize and help determine the number of cases is using the positivity rate. This is the percentage of positive tests detected out of the total number of tests performed. This smooths out variation due to fluctuating numbers of tests. If you look at this graph, you can see that the positivity rate for the state of Florida has been fluctuating over the last 2 weeks between about 10% and 16%. So let's take a look at Pasco. This is a map of our county and cases by zip code. The red areas indicate that there have been 300 or more confirmed cases in the zip code. The dark blue areas are 200 to 299. Light blue is 100 to 199. Aqua, right down here, is 25 to 99 cases, and green is 5 to 24 cases, and yellow is fewer than 5 cases. However, with all this red on the map, let's look at our positivity rate. Pasco's positivity rate is trending downward and is lower than the state's positivity rate, which is really good. This is good news, but most epidemiologists would like to see a positivity rate of less than 5%. The lowest we've seen in the last 2 weeks is about 5.1%. So we're still not quite where an epidemiologist would start to take a deep breath. And this graph shows our running averages from June 6th to August 9th in Pasco. The orange line represents the average percent positive rate, and the blue line represents the average number of new cases. You can see that we are far above our June averages. We are still riding a curve of increased cases, but hopefully we can continue downward. Now, these are all general data points that apply to all Florida and Pasco citizens. So let's take a look at our kids. I hate that we're going to be looking at apples and oranges over the next couple slides, but I think that they give a good idea of what's going on. This slide shows us the distribution of cases in children under 18 by age group statewide. So our 14 to 17-year-olds do carry the burden of pediatric cases and make up 36% of positive pediatric tests, while children less than 1 year old only make up 5% of those cases. Statewide, we have had 7 pediatric deaths and 517 hospitalizations. And pediatric cases make up around 13% of our total cases in Florida. But remember, children under 18 are 19.7% of our total population. So we've kept the distribution lower in our children. And unfortunately, I don't have the granularity of data for Pasco, but you can see that 2% of our cases have been in children 0 to 4 years of age, and 3% have been between 5 and 14 years old. 15% of our cases have been age 15 to 24. Children under 18 years old, make up about 12% of our total positive tests in Pasco County, while the total population under age 18 is 20.2%. So this is a similar picture to the statewide data, but we are doing a pretty good job in Pasco of keeping our kids COVID-free. So how do we keep this going? What I'm showing you here is the NIOSH hierarchy of controls. This pyramid shows the most effective to least effective ways to prevent hazards, including infectious diseases. The most effective way to prevent infection is to remove the hazard. Unfortunately, until we have a vaccine or some other way to eliminate COVID-19 from our environment, this control will not work. Also, I can't really think of any way to successfully substitute the hazard of infectious disease, so we'll skip that one. So, however, we can use engineering controls to isolate people from infection, change the way we go about our activities, including how we attend schools through administrative controls, and use personal protective equipment to reduce the risk of infection. The lowest risk setting for students is virtual learning. This isolates the child from other children, staff, and environmental risks for contracting the virus. From what I understand, approximately 1/3 of Pasco children will be learning from home through e-learning during at least the first semester of this school year. However, for many families, virtual learning is not an optimal choice. For whatever reason, they cannot make that work for them and their families. So many children have to be in the brick and mortar setting, and these children will need to be prepared for the return to school. There are some other engineering controls that can be utilized, such as installing barriers and air filtration units to physically stop or remove the virus. But these controls may be very difficult to implement and very expensive to institute properly in the classroom setting. So, because they do need to meet certain criteria to block or filter respiratory droplets. So some schools, like Eckerd College, have decided to hold classes outdoors, which is a really interesting way to use an administrative control to mimic an engineering control. While outdoor learning reduces exposure, it does not eliminate it and may be very difficult to implement with school-aged children. Pasco schools are instituting administrative controls by instituting policies and procedures that change classroom, cafeteria, and hallway activities and enhance cleaning protocols. This includes implementing social distancing in the classroom, cohorting elementary age kids by keeping them in one classroom with one teacher and serving lunch inside the classroom, increasing cleaning of high-touch surfaces, and heightened sick child exclusion policies. Another good administrative control is signage and messaging. Children do need constant reminders, and school campaigns that foster positive attitudes toward doing the right things to protect the school community can be very helpful. And schools should encourage frequent hand washing and ensure children have access to supplies such as soap, water, and alcohol-based hand sanitizer. Pasco schools will have children wear masks during the school day at the beginning of the school year. Now, I've gotten a lot of questions about masks and how effective they are. The rule of thumb, always remember, masks do not replace the need for social distancing. They do, however, reduce the risk of spreading disease by blocking respiratory droplets from the source person. So in practice, a cloth face covering is not to protect yourself, it's to protect others. So if all of our children wear masks, they protect each other. First and foremost, though, we have to have our children stay home if they're sick. Many of the symptoms of COVID are mild in children, and a child may present with symptoms that are not quote unquote classic for COVID. A child may have a fever and complain of stomach pain or diarrhea. While this could be a myriad of other different diagnoses, take your child to the pediatrician and get checked out. If there's another plausible diagnosis, your child may be able to return to school without a COVID test. I'm not quite sure on that. Pasco County will give directions for that return to school policy. If you have your child tested for any reason, keep them home until you have the test result. Asymptomatic carriers can spread COVID-19, so you want to make sure the test is negative before you send your child back to school. And if your child has contact to a known case of COVID-19, quarantine your child and communicate with the school and the Department of Health. Remember, the kids do best with constant positive reinforcement. Make sure they know how to wash their hands properly and use hand sanitizer properly. You'll want to talk to them about wearing their mask and maintaining social distancing. Now, I can tell you my 6-year-old is great about wearing her mask, and she's like the pod people. She's like, mommy, they're not wearing their mask. Mommy, they're not maintaining distance. But getting that child to wash her hands, now that is the challenge. So make sure you go over these things with your child over and over again. You can make a game out of social distancing at home so that younger children know what it feels like and looks like to be 6 feet away from other people. Talk to them about how others may not be doing the same things that they are. And they are doing the right thing by doing their part. Also, let them know it's okay to come to you if they have a concern or fear about COVID, so that they're not going to their friends for information that may not be correct. And as much as your teens and preteens are going to hate you for it, make sure they know the importance of practicing social distancing and wearing masks outside of the school setting. And consider limiting social and extracurricular activities for your child. And you need to make sure that they have the right tools to do the right thing. You can send your child to school prepared for their day. Send a bag lunch when possible and extra water bottles to reduce contact with shared environmental surfaces. And send your child to school with more than one mask in case the mask gets wet or soiled. You may want to give them a baggie or paper bag to store the mask in. If your child wears glasses, you might want to give them anti-fog solutions so they can wear their mask and their glasses comfortably throughout the day without having to make a tough choice on whether or not to see or wear their mask. So these are some of my tools that I put in my toolbox in my home. And a lot of this is, most of what I've said today is based on recommendations from the CDC website. And I encourage you to visit the site frequently and stay up to date on the newest guidance and keep us all healthy and safe. I really thank you for your time today, and I hope this presentation has been helpful to you and your families. Thank you so very much.
Thank you, Jennifer, so much. This is Chris. There is one question in the chat. It is from Cindy. She says, I hear from parents who say my kids will be with the same group of children all day long, so they will be fine. It still seems risky to me.
That is, okay, so cohorting the children will reduce their risk by limiting the number of contacts that they have. So yes, those children will still be at risk, but they'll be at a lower risk because yes, those children go home to family members, they go out in the community to work and so forth, so they're at risk that way. But instead of having a child attend 2 classrooms with 16 children, making their potential exposures 32 other children, or 34 including the teacher, you're limiting it to 17 with 16 students and 1 teacher. So you're just limiting the exposure. It's not really going to make it as safe as quarantining at home or doing virtual or e-learning, but it is safer. Now, this is going to be really hard for our middle and high school students, that their class matrix makes it almost impossible for them to cohort. But I know that the school board and the Department of Health are working together to try to find some good solutions for those age group children.
Thank you. A follow-up question to that. So specific to students who do not wear their mask, so if I was a parent and I'm wearing my mask, but I know that a student is not and doesn't want to, are there plans to tell those students that if they can't wear their mask, they must stay home? Or how is the board going to handle that? Do you know?
I know that their preliminary plan is that children must wear masks. I don't know if they will send the child home if they don't wear their mask, but I know that they're putting it out there that the child must wear a mask in school.
And, I'm sorry, go ahead.
No, that's fine.
No, I know that, I realize that's administrative. And the other question I had before I get to one that's in the chat, are there nurses at each of the schools full-time? And in addition to that, if a child has symptoms, is there a process in place where they can be tested quickly?
All right, there are not school nurses in every school. A school nurse is assigned, I'm not sure if it's 2 or 3 schools, but usually those schools are close together. You know, the middle school is next to the high school. Mm-hmm. But we are working with the school district to ensure that we are providing testing as soon as possible. If a child becomes ill in the classroom, the Department of Health, Bureau of Public Health Laboratories is tasked with processing those samples. We're working on equipment to maybe do rapid in situ testing. And so we're making sure that we streamline this for the parents and make sure that they have access to timely testing and results.
I think that would be really helpful. Another question was, did Pasco teachers receive a classroom sanitation kit? If so, what's in the kit? And I wondered if, I assume students will also be bringing supplies.
I cannot speak on that. I'm not sure exactly what the school district is doing to, I don't know if they're giving the teachers a specific kit for sanitation, but I know that they have increased their sanitation protocols. So they're going to be cleaning those high touch surfaces. If a child becomes ill, the classroom will be shut down until it has a deep clean, things like that. So, and I'm sure that my mother is a teacher in Hillsborough. So I can tell you what she's doing is she's making sure she has all the cleaning supplies she needs for her classroom. She works with severely and profoundly handicapped children, so she knows she needs to keep them safe. So, so I know that the teachers and the school district will work to make sure that they have the proper supplies. And instead of just bringing paper and notebooks and things that donate into the classroom, it might involve hand sanitizer and things like that. But I can't speak exactly to what the school district is doing.
I don't know if you, thank you. I don't know if you read the paper today, but there was an article about kids' feedback on wearing a mask. Did you see that in the Tampa Bay Times?
I did not.
It's an interesting article. You should look at it. They asked some adults as well, but they asked some children to try out the mask. And I didn't know, is there a type of mask that the Department of Health recommends for younger kids by chance?
There is no specific recommendation on masks. What I would say is you will need a high thread count cotton that is more than one layer. So a 2-layer high thread count cotton mask is ideal. Some studies have come out that say that it's pretty effective at blocking those respiratory droplets. Silk is another material that was tested, but cotton is far easier to come by. And you know, my husband and I made a bunch of masks. So we had a little assembly line going on in our house, and we cut up old sheets.
Oh,
Yeah, sheets that had ripped or were, you know, faded, and their high thread count, because you always see that on the packaging, you know, 400 thread count or whatever it is, 600 or so. Old sheets work really well, and you can put a layer of quilter's cotton with cute animals or whatever you want on top of that. So cotton is really easy to breathe through, but there's no specific recommendation. I apologize, I don't have that.
okay. And another question is, do you have specific recommendations for 3-generation households?
My recommendation for multi-generation households, and there is guidance on the CDC, but you should try to limit interaction with those 65 and older, or those with chronic health conditions that put them at higher risk for COVID-19. You should limit the contact between the people going out in the community and those that are at risk, and do frequent cleaning of shared surfaces like kitchens, and have that person use their own bathroom if possible, or the person that's going out in the community, if you have the ability to separate it out like that.
Thank you. I don't see any more questions in the chat. There was a request for you to place into the chat, if you have it available, the internet address for the CDC website for keeping children healthy during COVID-19.
Sure.
Thank you. Any other questions from anyone? I think it'll be an interesting school year to see what happens once these children start going back to school. Anyone else? Christine, you want to close this out?
I can. Jennifer, was there anything else you wanted to say or add?
I know this is a very difficult time for all of us, especially our children, and teaching them how to stay healthy and empowering them with the knowledge that they need to look after themselves and others is the best way to prepare your child, in my humble opinion. I really, once again, just want to say thank you for giving me the opportunity to speak on this topic. It was wonderful. Thank you.
Well, thank you so much. We really appreciate you being available to talk with us today.
Thank you, Jennifer.
Yeah,
You're very welcome.
Cindy, do you want to share the little thank you document?
Certainly.
Cindy is our high-tech team member.
Just sometimes takes a minute here.
Yes, but
And this is Chris. Jennifer, I would add that if there is ever some health issues that you think that you would like to reach out to us so that we can put on a meeting and kind of spread that information, please reach out to us. We're always looking for information that's important to our communities to pass on.
Thank you. I will take you up on that invitation. Thank you so much.
Christine, I have the welcome. I do not have, oh, I see the second page. Is that it?
Yes. Just real quick.
Oh, thank you. Okay.
You got it? My voice is almost gone. Well, actually, we mentioned some of the things that are on the share that Cindy is about to put up there. There it is. Just a reminder that the League is having their membership meeting August 24th, and we're all looking forward to that, League members. And we are co-hosting the candidate forum for Florida legislature candidates on September 29th and for superintendent of schools and county commission candidates on September 30th. And we are working on a forum for U.S. House of Representatives. We don't have a date on the calendar yet. Also for members, for League members on the Zoom meeting today, if you haven't renewed, it's time to renew. And if you're interested in joining, there is a link there that shows where you can link up to the Hillsborough League and join. I also wanted to mention that for any guest on the meeting today, that full-time students 16 years and older pay no fee to join the Hillsborough League in the Pasco unit this fiscal year. And if you have young people in your family, this is a good way to get them involved. And I wanted to point out that the the Vote 411 guide is available, and many candidates have responded to questions that have been sent out to them. It's a good source of information about candidates. So the www.vote411.org/Florida website is available to anyone and available for you to share with your friends and family for information. And I think that's it. I want to thank everyone for joining our Zoom meeting today, and take care and stay safe. And Jennifer, thank you again so much.
Thank you so much, Jennifer.
You might be hearing from us again.
Anytime. It's
On another
a pleasure.
Okay.
Thanks, Jenna. Yes, thank you.
That was very interesting.
Glad to share the information.
A good day, everyone.
Okie doke. All righty. Bye-bye.
Goodbye.
Bye.